For those that are not familiar, Care Design is one of the three CCOs, care coordination organizations, that support people that live in New York City and the surrounding areas.
Yeah, and I'm sorry, Luisa, I had recording kind of in the middle of that because
That's
I just
okay.
remember to record for those who may want to view the presentation once again. Um, so just to be the record there, again, my name is Wendy DeLeon and I am the co-chair of this committee. Also, I think I forgot to say I am the director of housing assistance services at ADAPT Community Network. And now, if you have an announcement that you'd like to make, um, please raise your hand and we can call on you. This is the opportunity to mention any services that your agency offers or any particular meetings open to the public that are coming up and so on.
Wendy, I can make a quick plug for CCOs in general, both,
Yeah.
including Care Design, but also ACA and Tri-County Care, which are the two other CCOs, as well as Partners Health Plan, which is a little different, but the CCOs are able to provide the entryway into accessing all of the other services that are available under the auspice of OPWDD and provide support in accessing all of that from start to finish. So you can contact any of the three CCOs. They will support you in obtaining eligibility for the other services and prepare all of the documentation and support necessary to access any other services within the scope. So all three CCOs are listed on OPWDD's website. You can reach out to any of the three to connect with somebody from the enrollment teams, and wherever you're most comfortable, connect, and then they'll walk you through the entire process until you can get through all of the doorways that OPW has in place to access all of these services.
Thank you so much, Luisa. And I guess no one's raising their hands. I also just want to mention Adapt Community Network does their annual Family Connect Summit, and we will have one again this year in October. Currently, we're calling for proposals for potential speakers. If you did not receive the email calling for a proposal for any presentation you may be interested in doing or any topic you think may be interesting for the summit, please let me know and I can email it to you directly. Just send me a message via chat with your email. Also, I see there's some information being placed on the chat, which is also a great place to share information. So by all means, if you cannot unmute yourself or do not want to say it out loud, do share it on the chat with everyone. And also, I wanted to mention before we get started, we are having our annual um, Manhattan Family and Professional Resource Fair. We will have more information to share with you
Now
soon.
this is ready.
Milka, did you want to make an
No,
announcement?
my bad. I'm sorry.
That's okay.
Sorry about that.
No problem. We will share that information with you soon. But in the meantime, your respective agencies should have received an email from Yesenia Estrella asking to update your information, your agency information, as it appears in our family support guide. So please check with your contact or your folks at your agencies to make sure that they receive that information. If not, again, please let us know either via chat or send myself an email, Luisa, or even Jasenia, letting us know, hey, my program's not mentioned, or I just want to make sure that my program information is being updated for the upcoming Family Support Services Directory. And without further ado, I will pass it on to Terry and Nicole from Adapt Community Network. I'll let you guys introduce yourselves. And I believe you're both co-hosts, so you can share your
Hello?
presentations at any time.
Yes.
Okay. Hi, my name is Terry. My name is Terry Wong. I'm from Adapt Community Network. I am the Director of Doorways to Independence Program. I will be presenting with Nicole Pagano, who will be presenting on family reimbursement. I'm going to share my screen. Okay. Again, we're the presenters, Terry Wong and Nicole Pagano, and Nicole will introduce herself later on.
Good morning, everyone.
Sorry about that, Nicole. Let me tell you about Adapt Community Network. We are a human service not-for-profit agency providing cutting-edge programs and services for people with disabilities. We build a more inclusive world for thousands of New Yorkers through education, technology, health, residential, and recreational programs in all 5 boroughs. Our mission is to empower people through innovative solutions, one person at a time. So today our presentation is on home modification and repairs, as well as family reimbursement. I wanted to tell you a little bit about housing assistance services because I work with housing assistance services when there's a need and we work together. So it's a lot easier to introduce housing assistance services, also known as HAS. So Housing Assistance Services Program helps families with household members with intellectual or developmental disabilities navigate the housing system. We offer advocacy support, information, and referrals for families seeking assistance with housing concerns. Who is eligible? Any family living in New York City with a household member who is OPWDD is eligible. So in order to get started, you would have to complete and submit the HAS application, and a request to open a case is submitted to DDRO by HAS. Then DDRO sends approval email to HAS, and a housing advocate is assigned to the family. Please note that we do not rent apartments and we do not have financial assistance. The housing advocate, each family is assigned a housing advocate who works with the family to meet their housing needs. We are able to provide information, advocacy, resources, and act as liaisons to outside agencies. We also have Spanish-speaking staff available, and we use the language line for additional translation services. There are a few common housing concerns. Let me tell you a little bit about them. For low income, we have people asking for affordable and accessible housing, and we assist with that. There has been some issues with rent arrears, especially within the past few years when COVID happened, and there were a lot of families looking for how to address their rent arrears. We are able to provide information so you're able to get some help. We also have applicants who has issues with vermin and leaks and hazardous conditions in their apartments. And we are able to advocate for the family to have it fixed or to provide solutions. We also provide information on eviction process and the housing court. So there has been some issues with people having issues with their landlord who may be harassing them for the rent. And so we provide rent assistance for people who needs assistance. And we also provide information on tenant rights. Sorry about that. I want to go next into Doorways to Independence program. The Doorways to Independence program is a home modification and repairs program. And we provide home modification services for people with disabilities and the elderly and the medically frail. So we cover the whole cost of modification through a grant, and that improves physical access and safety within the home. And anyone can apply for assistance. There are three fundings. We have two funding sources, actually. Excuse me. First is OPWDD. We have a OPWDD Family Support Services grant. We have a contract for individuals who are diagnosed with developmental disabilities and living at home. Sorry, I have to start. There's another funding source, which is Access to Home for Medicaid members. It is from New York State Divisions of Homes and Community Renewal that subsidizes home modifications for low-income families facing accessibility issues. I have another grant from Homes and Community Renewal, and it subsidizes emergency home repairs to assist senior citizens homeowners. And this is only for emergency home repairs. Let me tell you a little bit about the OPWDD Family Support Services grant. This is available only in Brooklyn, Queens, Bronx, and Staten Island, not Manhattan. The applicant must reside with the family, and anyone can qualify for assistance as long as the person is diagnosed with developmental disability and is approved through OPWDD. So you have to be eligible through OPWDD. There is no income requirement to qualify for this assistance. Also, if you have self-direction, you need to have a budget for home modification and repairs under Family Support Services. The budget's requirements are different for each borough. So for Brooklyn, you may need $6,000 in your budget. For Queens, you may need $12,000. That's the cap I have for the borough. Another grant that I spoke about is Access to Home for Medicaid Members grant. It's through New York State's Homes and Community Renewal. This service is available in all 5 boroughs, and anyone can apply. You can be living at home with the family, or you can be living independently. This means that if you are living in an ISS, you would qualify. Well, maybe. You only because there is an income eligibility that is required for this grant. And we would have to look at the income information. The applicant also must have permanent physical disability or have substantial difficulty with activities of daily living. So there's no age limit, and OPWDD eligibility is not required. And you can be a homeowner, a renter, you can be owning a co-op or a condo. And the project cap is $25,000. And the allocation of funds may vary. So the other grant that I have is called Restore Grant. It is a residential emergency services to offer home repairs to the elderly. This service is available in all 5 boroughs. The applicant must be 60 years old or older and is named on the deed. The applicant must own and occupy as primary residence the unit or the property that requires emergency repairs. And there is an income eligibility that is required. And the project cap is $20,000. This is a list of some typical repairs that are eligible under the Restore program. Serious structural issues. We could repair or replace a damaged or leaking roof. We can also do accessibility modification, which would be a vertical lift, a ramp, or a stair lift, or even modifying the bathroom. We would be repairing or replacing failed HVAC systems. We can also do repairs to stairs, mold remediation, and other things. This is not limited. Basically, we would check with the Homes and Community Renewal and make sure that it is possible to assist. So I wanted to tell you about what we do. So we provide full project coordination. So that's me on the photo. Once I receive an application and documents, they are reviewed and make sure that you are eligible for the program out of 3 that we have. Your name is put on the wait list. So once we have your application and you're on the list and we have the funds available, and so I pick an applicant based on the order of date that I received the application. Once you're chosen, I would send a person to do a home assessment in your home, and the scope of work is written. A scope of work is something that we would do within your home, but we would get that information through observation and through a conversation with you and the family members. The program manager and the family decide on one project to complete once we have the scope of work. So most homes don't really have just one project. They may have other issues at home that needs assistance with. So we would choose together what project we would want to work on. Once the project is chosen, I would send contractors to your home. They be 2 people or 3, and they would send me a proposal of the cost, and we would choose the vendor with the lowest bid. So once we have the vendor that we chose, we would send the information to the funding agency, and they would approve or not approve. And once it is approved, contracts are signed, deposits are sent, and the project starts. Most projects, like a stair lift, would take about 1 day. A vertical lift would take about 2 days or so. For a bathroom modification, it would take about 2 to 3 weeks. These are some of the type of modifications that we do. And I have photos to show you after this. Some things that I don't have is a durable light alerts and alarms for the doorway. We do provide fences. And that is it. The other things that we do are ramps and stair lifts. And we do provide grab bars and handrails for stairs, as well as the bathrooms near the toilets and near the wall in the shower areas. We also provide roll-in and walk-in showers. So let me show you the before photo. As you can see on this photo, this is a portable ramp that the family has been using, and you can see that it is very steep. So they called me and we provided a new ramp, which was a little bit longer based on the ADA, and it would come down and go sideways. So this is where the old ramp was. And then we came around and came down the sideways. We also provided stairs so that people who do not use the ramp would have access to that. These ramps are considered modular, and they have interchangeable parts, and they are also considered temporary. So the ramps cost based on the size, it would cost from $2,000, $9,000 or more, depending on the parts that they use and the length of the ramp. And we install ramps that meet the ADA guidelines. This is a sample of a straight stair lift. A stair lift can be straight or curved. Let me show you. So the chair will glide up and down the rail. You can see the rails here, and it's attached to the stairs. A stair lift comes with a standard seat belt, as you can see right here, and we can provide a harness. So we can provide a 5-point harness just to like a children's seat. And we can also provide an ankle strap for support if you need it. So the Department of Buildings require that a safety inspection is completed each year, and the family is responsible for maintenance and repairs. This is a sample of a ceiling lift. This is a standard ceiling lift. This one is in the bathroom. So this is a motor, and this little gadget will come down, and usually a sling seat is attached to this bar, and you would be able to transfer a person from one area to another. This is a portable ceiling lift. So you can see this little handle. This will do the same thing as this. So this motor will bring the sling seat down, and then it would bring the sling seat up, and you can transfer a person to another area. But with this little gadget, you would be able to take this apart, bring it out, and attach it to another ceiling lift in another area in your home and use the same thing. So a lift motor is also used to control the remote. So you can use that. Remote is used to bring the motor up and down. So this item is similar to a Hoyer lift, but it's just attached to a ceiling. This is a sample of a vertical platform lift. I wanted to show you how it looks from the bottom. And when it gets to the top, we always have a door, a gate on top of the stairs so no one falls in. And then this is what it looks like when the person goes in. So we provide limited number of vertical platform lift, and we normally do it through Access to Home grant. The price ranges from $20,000 to $25,000. Usually, we always get a permit to install a vertical platform lift, and Department of Building requires that an inspection is completed each year, and the family has to keep records. This is a sample of a roll-in shower. As you can see, there are no barriers. So a person in a shower chair, rolling shower chair, can roll into the shower area and take the shower. This is a sample of a regular shower that you may have in your home. And we also provide that for people who are able to walk. However, they may have difficulty lifting their legs to go into a tub area. So we would provide a walk-in shower. The bathroom modification takes about 2 to 3 weeks from start to finish. We also repair stairs, and we also add rails. So as you can see, this before photo, it's curved and it's falling apart. So for this person's home, we had to change this to a straight stairs, and we also provided rails. And for this person, as you can see, there's nothing. There are no rails, no guards. So we provided the whole thing so the person would be safe going up and down the stairs. We also provide durable medical equipment. Any durable medical equipment should be requested by submitting to Medicaid, Medicare, or personal insurance. If the Medicaid submission is denied, we can assist you pending availability of funds. So when you're sending me a request for payment of durable medical equipment, I would require that you send me a denial letter from Medicaid and a copy of the justification letter written by an OT or PT, along with the application. Some samples of a durable medical equipment. This is a special needs stroller. This is an activity chair and a shower chairs. Also wanted to tell you a little bit about assistive technology, environmental modification, and vehicle modification services. As you know, this is only provided through EMODS, through OPWDD. They have their own area where they use this OPWDD comprehensive waiver. So basically, it is all up to the care manager to start the process. And the care manager will help the person and see if the supports are needed, any kind of assistance, any kind of accessibility modification. And they will put this information in the life plan, and the care manager will request for a special assessment to help decide what is needed and work with OPWDD to submit the service request for the individual. Now, I attached the website, so you would send an email to OPWDD, the mailbox. But if you click on this link, you would be able to access the information on all of EMODS and VMODS information, and it gives you a nice guideline. So I'm going to stop, and I'm going to have Nicole Pagano. She will be presenting family reimbursement information. Thank you.
All right. Thank you so much, Terry. All right, everybody, I'm just gonna share screen. Terry, can you see my screen now?
Yes,
All right, thank you.
Uh,
All
Ni-
right,
Nic-
thank you so much,
Nicole,
Terry.
I'm
Yes.
sorry, before you jump in, just for everyone else, if you have questions about what Terry presented, just please put them in the chat. We will get to questions at the end of the presentation. Thank you.
Yes, absolutely. So keep your questions in mind. We will make sure we have time to answer any of those questions. Also, some of the information, especially with HAS and also home modifications, is a little dense. So Terry obviously is the home modification extraordinaire, and she's been doing this quite a while and will really take you step by step, whether family member, care manager, through the process in terms of, as she spoke about, overseeing the whole project. So no need to, feel like you have to know every facet of that. Like she mentioned, there's 3 grants. It's very unique because for one of those funding streams, you do not have to be eligible through OPWDD. You don't have to have a disability. So keep that in mind for family, friends, folks that might have disabilities, but their grandmother, their, aunt, their caregiver, to ensure that they can stay in place and age in place with their loved ones. So thank you so much, Terry. So now I know it's a popular request at 10:30 in the morning to talk about family reimbursement, but I promise we will try to make this as painless as possible. What we'd like to convey with this webinar is it to be mostly informative, right? I know, family and care managers for family reimbursement, you can do this application. So we're just going to go through the program. We're going to highlight some of the changes. It went 15 years with some of the same regulations. Not a whole bunch of oversight. It was basically everything was approved, and that came to a screeching halt. So we're going to talk a little bit about there are some roadblocks, but how can we get around those roadblocks? How can we get you what you need through the proper justification? So right now, just to kind of start at the basics, what is family reimbursement? So family reimbursement is funds available for families to enhance family unity and the ability to provide in-home care to their family members. So the family member must have an intellectual or developmental disability and be eligible through OPWDD. I do want to mention they can be head of household and live with their family, their children, right? Whether or not their children have a developmental disability or not. We've had individuals who are head of household, they are eligible, and also their children are eligible. So that would be 2 separate applications. So you can keep that in mind. And I'm going to highlight a little bit more of the emphasis of what is new is that reimbursement may only be provided after families have sought funds through all other funding sources. That is something that changed when the new ADM came out. So what does that mean? If you want to request, durable medical, and Terry's program can possibly provide the durable medical, we would put yes, we would go to Terry's program first. If it was denied through her program and through Medicaid, then you could come to family reimbursement. So think of this as a safety net service. OPWDD emphasizes this is a service of last resort. So why is it important to know about the Administrative Directive Memorandum, or known as ADM? So many of you on this call today are very informed, kind of preaching to the choir, so to speak. But if you are new, if you're, a family member, a new care manager, it's really important that you go on the website routinely, OPWDD, sign up for their emails. This is where we get our notifications for changing requirements so that we can hopefully avoid moving forward what happened to us when the new ADM came out, which was that people had already put in their applications and then they were denied because there was new guidance. So an administrative memorandum, for those of you who might not be familiar, an ADM sets forth all the requirements for the New York State Office of People with Disabilities and FSS Family Reimbursement Program. So please highly recommend, in addition to meetings like this that are vital to information, also check out opwdd.ny.gov for updates, sign up for their emails. This is how we get the information we need to make informed decisions, whether we might agree or not. So the Family Reimbursement ADM contains eligibility requirements, roles, and responsibilities for the providers, the people seeking the support, family members, and care managers. And it outlines how to request and process FSS reimbursement. So the big change happened July 1st, 2022. And sometimes we find out very close to that date, what some of these changes are. So eligibility. So again, we're kind of sticking with basics right now. To be eligible for consideration of family support service reimbursement, individuals must have established eligibility through OPWDD. And as I mentioned, it could be, a child living at home with their parents or a parent who is head of household. Reside with one or more non-paid family members. This is super new too, i.e. could be biological, adoptive. It's basically a direct caregiver as long as they're non-paid. So what does that mean? So some family members are compensated, right, through CDPAP, or they function as home attendant, right? So in that case, then they would not be eligible for family reimbursement according to OPWDD. So as long as the caregiver is non-paid, and we indicate that on the application, then eligible individuals are ready to go. So just keep that in mind again. Funds are available in all 5 boroughs, which is important. And families are eligible for a cap up to $3,000. Historically, it was $500. Now it's $3,000. So when a lot of families hear that and providers, for the first time, we're like, oh my goodness, 3,000, that is amazing. And then the other shoe drops, and it's a little harder to get to that cap, but not impossible. So $3,000 is the cap. You can dip within a fiscal year more than once, right? So if you only need 1,000, and then you can come back, right, and recoup the rest of that, as long as they're all eligible items. And the receipts are within the funding year or contract year, which is different from a calendar year. So July 1st through June 30th. You do want to make note of that. Your receipts must be dated within that time frame to be eligible within that fiscal year. Okay, so that's one of the things we look out for. So what are some of the requirements, the basic requirements of applying? You complete the application. It's a pretty straightforward, simple application, 3 pages. Not a whole bunch goes into actually completing the application, which is good. You do need verification of your OPWDD eligibility. So what does that mean? You need a life plan and an LOC. So if you're not familiar with the level of care, that can come from your care manager. Every 6 months, you should be receiving a life plan meeting. So these 2 documents are required. And in addition, an NOD, a notice of decision, which you would have received as soon as you got eligibility, or a psychological. So you need 3 documents in total for verification of eligibility. So that goes with the application. Verification that the individual resides with a non-paid family or caregiver, which we mentioned before, which is a simple check off on the application. Receipts for the items to be reimbursed as long as they're dated within the fiscal year, July 1st to June 30th. Now, proof of payment may be required for bank statements, credit card statements, if you've made online purchases. What I want to mention here is that historically, and if you've applied historically, we needed the actual application and we needed the actual receipts. Now everything can be copies. You can simply email the whole packet over to the family reimbursement coordinator, and we could take care of it, which is much easier. No more trips. To have it mailed. You can simply scan or take a picture and email it over. Now, what's really important and what is newer since 2022 is the medical, medical justifications. We'll get to that in a minute. You do need a Medicaid denial letter. So these are items that might be funded through Medicaid or any insurance. So that is important. And we'll talk a little bit further in just a minute about what needs a Medicaid denial letter and what doesn't. Most everything needs a Medicaid denial letter, okay? So we have had many questions come up about, well, I reached out and they don't cover that item at all. They're not going to deny it because it's not even within their wheelhouse. So in those cases, OPWDD has agreed that we could just get a statement that says they do not participate in covering that at all. Hence, they don't provide, they can't even submit, right, through a pharmacy or for, so just a letter clarifying that, and they have accepted that. The medical justification letter. This is where most people get snagged, okay? And a lot of that is very understandable. Doctors sometimes give some pushback about clothes and having to provide medical justification for clothing, right? So with this, we make a lot of recommendations as to what to ask, even if you want to write it and you can give it to us and we can kind of help you to develop this letter where all they have to do is sign it. What do you have to know? The majority of items now that are requested, even things that you might not think, like clothing, need a medical justification. Everything has to be linked to the developmental disability. No longer are the days of my child grew out of his clothes. My child gained weight, just needs new sneakers because it's a new year, has to be linked. And we'll talk a little bit about what is that link and how we're helping families make that link so that they can get the items that they need. What do you have to know about medical justification? It must include the license number. It must be signed and on letterhead. This is what gets most families and delays the process. Okay. But we do acknowledge this is pretty tough because, doctors are very busy. And then here's this, I need a shirt, letter. And, sometimes they don't sign it and then they don't have their license number. And then, so this is important to think about if you're going to apply, that you need to start reaching out to the practitioners. Okay. And we can help you with that. We can give you ideas, give you a template, whatever you need to assist you to explain this kind of unique request from your doctor. Explanation of need. So this, a care manager can write. This is on the application, and it's also going to be found in your life plan. That is also a requirement. We recommend strong language, folks. This is vital, right? This is very important to, development, independence, quality of life. The stronger the words, the verbiage, the more likely for approval. So what does the application look like? The good news is it's very straightforward, a simplified application, demographic information, what items are you requesting? Here, have you tried from any other funding sources? Now, it's okay if you haven't, because in a lot of cases, there's nowhere else to go for these funding sources. Again, durable medical, we would just need to run it by that department to get that denied, and then we can assist you. List here everything that you've applied for, checklist of required documentation, and then how does this request directly relate to individual's disability? So a parent, self-advocate, or care manager can fill this out. You can do this yourself, and that's perfectly fine. It doesn't have to be a care manager. And then at the end, we added another more in-depth checklist just to try to kind of bypass some of the issues that families were having with some of these new guidelines. So just another check for yourself to make sure that the more likely you are to submit a complete application that's correct, the more efficient and the quicker hopefully we can get your reimbursement. Otherwise, it does get held up. All right, so life plan. The requirement for an updated life plan. The request for family reimbursement services must be found in Section 5 and Section 1. This has also been kind of a tough spot too, to have the information very clear. It should include the items. It should basically back up the request, right? So everything goes together, the medical justification, the life plan, you have your eligibility and receipts, right? So Section 5 of the life plan, which is all supports and services funded and natural community resources section. So in this section, it identifies the services and supports in the person's life along with any needed contact information. So you want to make sure that this is where it's pretty generic. It's just the service, the person that's overseeing that department, and the request. Now, Section 1 is a little bit more involved because this is the assessment and narrative summary section. So this is where the care manager should explain what has been requested, the reason and link to the disability. The stronger the language, the clearer the request that is linked to the disability, which in some cases is a little hard to navigate to kind of find that link. In some cases, very simple, depending. This is very important because this is basically yet another justification as to why this is necessary, right, for this person, and is a last resort. And it is recommended that applications for reimbursement be submitted no later than 90 days after the purchase of goods or provisions of service. This is up to the agency discretion. Why am I mentioning this? Because ADAPT does not enforce this, but some agencies might. So you want to ask, depending on what provider that you're utilizing for family reimbursement, does it have to be within 90 days? You don't want to miss that cutoff because they have put that up to our agency discretion. In terms of ADAPT, we do not enforce that. Okay, self-direction. So self-direction pretty much is, overlaps is pretty much the same except for a few things due to the budget. So the service must be listed in contracted service category along with the provider agency and the budget cap, right? So although if you might have a $700 cap, but if you didn't have self-direction, it might be 3,000 just because the funds might be allocated in other categories. The request and approval process is the same, except for summer camp is not permissible. Family support service reimbursement may be accessed while the individual is waiting for their self-directed budget to be approved. That has come up multiple times, and we are able to process that application if you are waiting for your budget. So it must include FSS in their self-directed budget, and FSS reimbursement is counted towards their total personal resource account, or the PRA. Therefore, individuals who self-direct cannot receive FSS reimbursement outside of their self-directed budget. Individuals who self-direct their services can be reimbursed via the Individual Directed Goods and Services, or IDGS, other than personal services, which is OTPS, or FSS. Individuals must seek to be reimbursed via IDGS first. If the goods and services cannot be funded under IDGS, the individual must then explore other funding mechanisms, such as the OTPS and family reimbursement respite, prior to requesting FSS reimbursement. So same kind of stream of thinking is just to exhaust every other category before doing that in terms of exhausting other funds. So just remember the cap is whatever your budget cap is. It's not automatically $3,000. So the application process, justification, is all the same though that we discussed before. Direct purchasing. So for a year this stopped. Direct purchasing is great because the family doesn't have to take out of pocket, right? So if for a lot of the purchases, the money's already spent. So what if the application is denied, right? That's where, families are very frustrated because they've already purchased these items. So for bigger ticket items, camp, classes, things like that, we can do direct purchasing, which means there is no money taken out of family pocket. The provider will pay the vendor directly for the goods or services through direct purchasing. In these cases, the family must submit an application or an explanation with the request, including financial hardship. Every application should say financial hardship. OPWD sees this program as obviously only providing funds for families that are experiencing financial hardship. That's also a very good terminology to put in all of your justifications, right? That's kind of like you start with financial hardship and you build upon that justification from there. That's kind of the foundation. If the item is returned, sold, or is no longer in the family individual's possession, or if the class or camp session was not attended, the family must notify the FSS provider and plan to reimburse the FSS provider for the cost of that item. So that is important. But big ticket things, camp, classes, things that might be $2,000, $3,000, once approved, we cut a check to the camp. So this is great. Please keep this in mind, because if anything should happen and it's not approved, at least there was no out-of-pocket cost to the family. Emergency reimbursement. So this takes a justification and then ups it a little bit more. This needs to be a true emergency. There was a house fire, right? And now folks need clothing, food, or money to live elsewhere. Documentation substantiated the need, like eviction notices, letter of justification from care managers are, vital. Verification of service by exterminator if it's a rent pest control issue. These costs can be very expensive. And we've had, all kinds of like vermin and things like that. Of course, it needs to be an emergency situation wherein the person needs to, the environment needs to be changed immediately. And you could think about some of the questions that might come up, right? What has the landlord done? What's the current situation of the family? Why is this a family reimbursement request? But to keep in mind, if somebody's experiencing a family emergency, rent, pest control, utilities, food, clothing, durable medical, remember that family reimbursement may be able to help. So other things that are reimbursable. Camp, this is a big one. This is a fairly easy request to get approved. So highly recommend camp. So what are some of the prerequisites here for camp approvals? New York State camps only. Historically, we could do camps in New Jersey and things like that. So just keep in mind, New York State camps only. Request requires camp operating permit. So all, camps have this, and usually we can even request it from the camp. So they must have an operating permit issued from New York State Department of Health and local Department of Health. And/or families can now pay within the current fiscal year, and the child can attend within the first 3 months into the next fiscal year. Why is that important? Before, if the child wasn't attending within the fiscal year, their request was denied. So this is new. They've now approved this, new as in the last couple months. So we can take care of the financial responsibility of the camp, do direct purchase, no out-of-pocket expense to family. And then the child can then, because you imagine where July 1st to June 30th, and then in August, maybe camp is in August, they can then attend in August, which is wonderful. There is no medical justification required. Okay, so that is absolutely wonderful. That's one less step. If it is an overnight New York State camp, it's limited to 14 days. And please keep in mind, this excludes all home and community-based service or HCBS waiver camps. So a lot of people are like, what is that? And even when we call the camps, I don't know, what HC what? So we will assist you in the search to figure out if this is indeed a camp that is funded through HCBS waiver, because that would then unfortunately not be an eligible camp. So finding a camp that is not waiver is step number one. The Department of Health permit, very simple. They have that, and it's good, for the year. And then we can do direct purchase, no out of pocket. So, you're not taking a risk there by putting out $3,000 ahead of time. So that's the good news. Respite, there's been a change in respite. Previously, as of 2022 and a little bit prior to that, it was emergency only. And the way OPWDD described emergency for respite was a death of the direct caregiver or hospitalization of the direct caregiver. And there is absolutely no one else that can assist. If you couldn't prove that, the claim was denied. Now that's loosened a bit, and we're kind of getting back to the direct caregiver could potentially be in the hospital, or maybe other reasons could come up, like emergency travel. They have a loved one somewhere else they had to go take care of. There's nobody there to assist with the child or adult. So respite has loosened a bit. So if you were denied in the past because the direct caregiver was not either dead or in the hospital, now there's a little bit of leeway. So please take that into consideration to reimburse a respite worker to up to $3,000. Recreation programs and therapeutic classes, a new change for that within the last 2 months, no medical justification required. This is new. This also required a medical justification. Granted, this was a little bit easier for doctors to write, because if somebody has autism, now we could recommend socialization, hand-eye coordination issues due to CP, autism. A lot of these classes all kind of contributed to the same therapeutic outcome. So it was kind of easy, but highly recommend camp, highly recommend requests for recreation programs, educational programs, any therapeutic classes. What is that? Horseback riding, swimming, art, dance, and music, karate, sports. No medical justification. Everything else applies, right? Have to be in the life plan, eligibility, application. And that is fairly easy to get as well. Electronic devices, medical justification is required. Also, if the child is in school, we would need a letter from someone about what they have at school and that they're not able to take it home, right? That's been an additional step for electronics, especially folks that are in school. This does require the clinical justification for electronic device, laptop, tablet, whatever it might be. The clinical justification must specify how the device will be used, either for, homework or searching for a job, applications, or programs used for what purpose, right? And augmentative and alternative communication devices, this could be an application, right, or an app, even hearing impaired apps, things like that. Then we would need a medical justification stating that. And we would be able to then assist with a medical justification with that electronic device. Individuals are limited to reimbursement for no more than one electronic device every 3 years. So again, these are not things that you have to remember when you call us. We'll walk you through the process. But just to kind of mention other items that we've mentioned, again, we're only kind of talking about the big and most popular ones. Clothing requires a medical justification. Eligible expense only if related to the individual developmental disability. So how do you link a clothing request to the person's developmental disability? So let's just say, for example, somebody is on the spectrum, excessively choose their clothes, any kind of destruction due to behavior because of their disability, incontinence due to their disability, right? HICA, sensory sensitivity, they're ripping it off. They're, trying to pull tickets off, but they rip the items. Shoes are separate. This is a pitfall. This is a pitfall. Folks will get the medical justification for clothing and there's no mention of shoes. Guess what? The shoes get denied. So the shoes also have to be included as an additional item. And why would the person need shoes, or not why? Let's say an eligible reason would be that they drag their feet, destroy their shoes, things like that, right? They're destructive. They do, toe walking, to destroy the front of the shoes. There has to be a link to the developmental disability. Again, when families call us, we'll talk about some of these symptoms, right, that the person has due to their disability and how that might link to some of the destruction of their clothes. All of this will require medical justification. In some cases, a behavior plan, right? If somebody is destructive, if you have that, add that in with the application. That would be a support documentation, which would make it very hard to deny. So please remember, shoes are a separate item, a separate mention. Huge pitfall for families is that it'll say clothes and without the shoes, and then we have to send it back, which is sort of, it's a headache for families to have to then go back to the doctor to add in shoes. We do realize that this is, it's not great. So just so you know, going in, just remember shoes are in addition to clothing. Travel. So this pretty much was kind of this was like removed for a while. So it's back in, eligible to reimburse for transportation for individuals who cannot safely travel via MTA, Access-a-Ride. They will ask questions up to, disability MetroCard. Well, if they have that, so then we would need a behavior justification, either a letter from their psych or every reason possible and under the sun why they're not eligible for AAR, Access-a-Ride, or MTA. Should match the goals in the life plan, and that would have to be justified. But just so you know, travel is back on, just needs to be strongly justified. Durable medical, we touched on this already, would need to go to our dual-race independence program first, so we can say that, obviously we tried, especially since Terry's just 2 doors down. We're going to make sure that we put it through there. Durable medical requires that Medicaid denial letter, right? If it's covered by insurance, OPWD does not want to, cover that. So we need to just make that differentiation that it is not indeed covered, it's denied. Examples: wheelchairs, walkers, commodes, shower chairs, orthotics. Historically, mattress and furniture were things we could do. No more mattresses, no more furniture. Believe it or not, if you're not familiar with the program, mattresses were probably one of the most popular items, especially because, folks would have kids jumping on the bed, springs would be coming out, and we really tried with mattresses, and no matter how you cut it, they're not approving mattresses. Also keep in mind legal fees related to guardianship, special needs trust. You also need medical justification letter. All the other justifications apply, but just so you know that is very helpful for families that are seeking guardianship or preparing for their children's future and needs that legal support. All right, so as I said, we might have a whole bunch of questions. Just please write them in the chat. Wendy's going to help us kind of get through all of those to make sure that we get to everybody's questions. And then we're just going to jump into ComHab. I know most people are very familiar with community rehabilitation, also known as ComHab if you want to be hip. But so Adapt Community Network is open for business in all boroughs. What is ComHab? ComHab is a program at Adapt that is person-driven, outcome-based service. It is tailored to the participants' preferences, wants, and needs through the implementation of self-identified valued outcomes. This is an elective service. So people come to us, tell us what they want to learn. We kind of finesse that into a staff action plan. And then it's a one-to-one service where we work on those outcomes based on the overall or overarching goal that that person has. We focus on empowerment, independence, accessibility, and achievement. Community rehabilitation provides services to people of all ages. So all boroughs, all ages currently. So it's a one-to-one staff ratio. We provide community rehabilitation in certified sites, in community residences, so certified or in-home community.
Can you hear me, Nicole?
Yes.
Sorry, hi. I didn't mean to interrupt you, but I'm not
Not at
sure
all.
if you can see there's a hand up, and I don't know how far we want to get into the next part of the presentation. Maybe before taking a pause just to answer that person's question.
Sure.
I see Michael McKenzie. You have your hand up.
Yes.
Would
Do they
you
have
like to ask your
apartments in
question?
do they have apartments in Manhattan?
I'm sorry.
Do they have apartments in Manhattan?
So in terms of apartments, do you mean like certified sites, like residential, like an ICF or an IRA, or just,
Anyone
in the
doesn't
community?
matter.
So we do have residential certified site apartments, but we
Okay.
don't have just apartments for rent.
Okay, I got you.
All right. And we could certainly connect you with the folks that do onboarding for residential sites.
Okay, I'll deal with that. Cares.
Okay.
Thank you, Michael.
You're welcome.
Thanks, Nicole.
No problem. All right, bear with me. All right. Can you see my screen? You guys see it?
Yes.
Oh, okay, great. Thank you. So as I mentioned, ComHab, we are in all 5 boroughs, one-to-one staffing ratio in a certified site or in a community residence. This is for folks eligible through OPWDD. So they could be head of household, child, loved one. We can have services at the same time as home attendant, as long as there's no overlap in task. Community Hab, what are some of the supports? So we just went with some of the major trends. Executive functioning skill development is definitely a common thread amongst requests and a lot of the plans. So executive functioning is really kind of the foundation of any goal or goal attainment, because we're really kind of bringing people back to task, working on focus, organization, prioritization. How do we finish this task? How do we utilize time management to do that? Working memory, things like this. Community inclusion and relationship building, major theme. Folks are really feeling isolated, especially if they maybe haven't gone back to program, or maybe they're looking for work and they're unemployed at the moment. This is something where a lot of people are coming to kind of get back connected, to other folks and get relationships, intimate relationships, friendships, develop their social skills. How do I hold a conversation? I say hi, but after that, I don't know, so staff can come in and work, they can model, prompt utilizing the prompting hierarchy. So provide verbal prompts, physical prompts, gestural prompts, travel training, again, navigating New York City. It's difficult for anyone. So teaching what's Google Maps, how, safe practices, stranger danger, money management, another big one. This could be somebody who just, is working on just identifying the denomination of money, or somebody that's at the point where they want to manage a ledger because they have their own, apartment, and maybe they're falling into rent arrears because they're not really sure how to manage a budget. So these are all things that we assist with. Very important, relaxation, coping, and hobby development. So again, we do pride ourselves in being person-centered, which means that we're looking at the person holistically. So we asked them what they like to do, and some folks say, I don't know. So when you talk about executive functioning, sometimes people have issues with self-regulating, right? Or they become overwhelmed. That would be any one of us, that might become overwhelmed because it's hard to focus. I'm not comprehending, things like that. So relaxation techniques, that can be anything from learning yoga to just coping, counting and or distraction, right? Doing something else. When do I kind of leave this and come back to it in a better frame of mind? Hobby development, I mean, we run the gamut. Cooking, somebody has a indoor garden now with all the herbs that she's cooking with. Bible study. There's so many. So this is super important too. And usually it's kind of a conduit to meeting people that are like-minded that you might make very natural friendships with. So it's very important. Technology skills, absolutely. Anywhere from learning how to use your phone, emailing, social media. People that, let's say somebody's just in their 20s. So what is most people in their 20s doing to connect? What does slide into my DMs mean? I'm just joking, but it might be that. I'm older now, so I have to kind of keep hip on some of this tech stuff, but that's how, all jokes aside, that's how we stay connected, right? So if we are not engaging in technology, we're missing a whole part of how the world is functioning and moving forward and that trajectory. So whatever level they're at, we work on technology a lot. So the individual also and network of support or chosen network of support can participate if they'd like to interview and hire their own staff. That's important. We're looking for a relationship that's longstanding. So that is something that, we absolutely put an emphasis on. All right. So ComHab R, I just want to mention this. Some people are not familiar with ComHab R, which is just ComHab that takes place on a residential certified site. So to qualify for this, and this is still a one-to-one, ADAPT offers a one-to-one. There's other kind of ratios that other agencies might offer. To qualify for long-term in-residence ComHab service delivery, the individual must be elderly as defined 65 years or older, medically frail, or present with complex behavioral needs that prevents them from, maybe engaging in a day program or, other kind of neighborhood events, things like that. So it definitely is a collaborative approach. There must be an individualized justification for the provision of in-residence ComHab. So there is a separate document that is filled out, very brief, very kind of simple in terms of just a plain justification, why the person wants it, how they'll benefit from it. If the individual is medically frail, guess what? Medical justification letter. So as to why they might not benefit from other sources of interaction, day program, et cetera. And individuals with behavioral needs would need a behavior support plan, within that packet. The care manager must document that the individual and or family representative, when appropriate, have chosen to receive in-residence ComHab service and confirm that the provider staff action plan allows for safe and effective delivery in residence and also privacy is also there. ComHab R services initially and document every 6 months. It must be discussed and reevaluated in the life plan. Why is that? Most things should be reevaluated every 6 months, right? And it should be updated in the life plan. But this is because, in terms of a residence, that if somebody is, why is this community-based service that is supposed to provide exposure and experience and education happening on a certified site with the same 6 people that, this individual lives with every day, right? Which makes sense. We want to justify why they need this, as opposed to, why aren't they engaging in their community? Okay, so it just to keep in mind, but just so you know that it is an option. So that's our ComHab, kind of a quick kind of overview of ComHab. If you're interested, we are, ready to hear from you and walk you through the application process. Lastly, at ADAPT Community Network, we have a program, Project Connect, which is our information referral resource for assistance and support. Assessing services at ADAPT Community Network, our experts also provide information referral services to organizations outside of ADAPT. Very important, especially if you're a care manager or a parent or self-advocate. You can call us no matter what you're looking for, and they will provide you information based on that. So we serve individuals with intellectual and developmental disabilities throughout the 5 boroughs. Please feel free to call. If it is something ADAPT offers, they will connect you right to the director of that program. And if it's something outside of ADAPT, they will help you as well. Also with eligibility, Project Connect walks people through that process so that you can successfully go through the front door. Project Connect is available 5 days a week to answer all inquiries. And you might, if you don't already, you might want to just take note of the phone number and email with any questions that you might have. We are there to assist. I'm just going to leave this up for a minute. We could also provide, Wendy could also provide this information too. And then we can answer any questions that might have come up. You just stop sharing.
Thank you so much, Terry and Nicole. Yeah, there's a few questions in the chat, and of course, you could feel free to use your raised hand feature, and we can always call on you if you have any questions. So, from the chat, let me just scroll down here. All right. It says here, it looks like you do not service Manhattan families from OPWDD grant. Is that right?
That's probably me.
Yes.
We do not through the OPWDD grant. However, we do have access to home grant, which if you do qualify, or if the person will qualify, we can address that. But just to let you know, the access to home grant, we do have a wait list. We just received a new grant, and I am following up on the people who are on the previous wait list. So it will be a little bit of a wait before we do anything for you. I apologize for that.
Thank you, Terry. And another question for you is regarding income requirement.
Yes.
Is
So
there an
the,
income requirement? Oh, and sorry, the second part for that is when taking into consideration income, does that just mean the individual or the whole family of the individual?
so when we calculate income, we take the income of the whole household. So if you are living in one family home, then I would need income information from mom, dad, and the children. If you're living in a two-family home and your mom and dad lives downstairs or they live upstairs and you live downstairs alone, then I would only need your income, the person.
All right, and just to clarify, for the income, if you live with your family, it doesn't matter whether you're a minor or an adult, you still need the income of everyone if you're living under the same roof as other family members.
Right.
Thank you. And let's see, other questions here. If the individual has reimbursement for camp and there is a balance, can reimbursement be sought for the balance?
That's a really good question. It would depend how much the first initial reimbursement was. They would want that family to stick with the same provider. But if it was under the $3,000 cap, and it also depends if they are self-directed, right? Then they wouldn't be eligible if it came from their budget already. But they should be able to go back to the same provider if they have not met their cap and request the residual funds. So it really kind of depends on a little bit more information.
Thank you. And I think this also applies for when you were speaking about family reimbursement. Ira just asked a statement from whom. So I think this was when you were talking about the durable medical equipment or even the classes. I think there was some documentation required.
So for classes or camp, medical justifications are not required, but it should always be in the life plan. If a medical justification is required, that is a good question. From what doctor? It should be the doctor. If it is, durable medical, then maybe it would be the PT, right? if it's psych related, you want to kind of stay within that practice of, or that field, which would be like their psych doctor, you know, their behavior plan. So you want to kind of stick with the prescribing doctor for that item, if that makes sense.
And is there any point for anything under family reimbursement that can be requested where a statement from like the family or just the care manager would be needed? Any services are
Yes,
good
and
that you
that would
can think
be,
of?
that would be on the application, and it would be in the life plan as well. So that is always required for everything.
Can I just ask a clarification on that, since I asked the
Sure.
question? So when you, at some point in this presentation, you were talking about a denial letter from a Medicaid denial letter. And you're saying
Right.
sometimes they say that's not even in our wheelhouse, so we don't issue
Right.
letters of denial for that. So I've been in that situation. So the question is, who do I get the less formal thing that Medicaid won't cover it from? Medicaid won't say it in a letter. So who is supposed to say that Medicaid won't cover it in whatever I'm submitting as documentation?
So that's a really good question. When we've come across this, however Medicaid has informed you, that's what we use. If it's an email, if it's you know, a notation from who was, you know, who you spoke to, then that's what we've included. And it has been approved.
So not to beat a dead horse, but I'm just saying, let's say I call Medicaid 800 number, right? And they say,
Mhm.
we don't cover that. And I take notes and I say, on the following date, so-and-so, at the following time, I spoke to Janet at extension 49. And I write that letter. Is that sufficient?
So I'm gonna have to double check if that, we would need that letter, that would be first, but if we need something from Medicaid in terms of, um, I'm trying to think what they provided in the past, which would be maybe like a list of items that then doesn't include that, or I can find out, I can ask the coordinator just exactly what has been approved, because I really don't want to misinform you. But the notification that you spoke to them and it's not included, most definitely. I just want to confirm that we wouldn't need something from Medicaid email, or the script was sent back because it's just not covered, or, you know, not processed due to not being covered. It's along those lines, but I can definitely get clarification and take down your email.
Yeah, I would say also, and this happens a lot. Like I was just speaking to like someone on Spectrum, and I was like, can you just email me a link to
Mhm.
that information on your site? And you know, they do send that information. So worst case scenario, or just to cover your bases, if you will, I would say if you are speaking to someone at Medicaid, if you happen to call the toll-free number as opposed to chat with them via the site or email, you know, ask them, where online can I find that information? Or can you email me the link where that information is available, so that they can do the homework for you? They already know where this information is found. Most of the times, when you call these toll-free numbers, they do have to kind of look up that, you know, they don't have it off the top of their heads. They themselves have to look it up in their handbook or whatever it is. So
Mhm.
if they know where to find it, they can definitely forward it to you.
Ira, if
I
you
was
can
under,
put your email in the chat, I will, I'll get the answer for you today, just to make sure that I'm informing you correctly,
okay,
okay?
great. I just also want to say I was unaware of the chat function. That's great. And I'm just curious, would it be worthwhile to try, if you do use the chat function, to save it and submit that? If they say, yeah, we don't cover that in the chat function, to submit that?
Absolutely.
Um,
Anything that you have, anything, is just more justification towards the case. Really think about proving a case. That's basically how we view it at this point.
May I? If you don't have a Medicaid denial letter mailed to you, go to the person with the medical supply company. They will always have a copy because they send it to them as well. So you should be able to get the information there.
Thank you so much, Terry.
Thank you. And then next question is from Susanna. If a child has autism, a letter from their doctor is needed for social skills?
So great question. It was more recently, you do not need a medical justification for therapeutic classes, education classes. So that's everything from horseback riding to sports. You do not need that, but everything else applies. So it would have to be in the life plan noted, right, as to why. Stronger the language, more likely for approval. I think Mary has her hand up.
Oh,
I do.
Great.
It's actually, just to clarify two things. When one person asked if the individual got reimbursement for camp and there is a balance, can that be sought from reimbursement be sought for the balance? You answered for self-direction cases. But if that reimbursement for camp is under waiver services, then the small balance that used to be covered is not covered anymore.
Correct, correct.
So that might be what he was saying, because that balance is not available anymore to people. And with
Right.
Susanna's question about social skills, I think it has to be noted also that those social skills classes have to be open to the general public. Like, it can't be just to serve our population, which I think you know that, but that's very important with the social, they just, like SNAC just adds it to their information or their brochures or something.
Thank you, Mary.
thank you. The next question I see here is, this person has a question in regards to documentation required for emergency applications. They say, according to the ADM, there must be a plan to prevent reoccurrence of the crisis. Is the care manager, sorry, still scrolling, or the family required to write that document?
So is the family required to write the justification document? I'm so sorry. Was that the question?
That is my understanding.
Okay,
yes.
so that is absolutely true. When we've come across these situations, I mean, as it's in the ADM as well, but they do not want to approve if it's something, it's going to be a longstanding situation. So if somebody's in rental arrears, the family would need to justify how, yes, this is needed for now, not on a permanent basis. And this is how we're going, this is the plan right now to rectify. We're working with housing assistance program, where, finding a lower income apartment. There would have to be something in terms of a plan to prevent whatever this emergency situation was where the funds are needed. That's absolutely the case. And that could come from the care manager, the family, maybe the person that now you're working with, maybe an agency or something like that. Depending on the situation, maybe it was a house fire, now you're in the hotel, but this is only temporary and then you're going to be here. They want to hear about all of that, the plan to get back to, a stable kind of place.
Thank you. And the next question, I think this one has to do with the portion of the presentation on ComHab. So does your agency provide sex education and self-protection, in parentheses, they put from predators, for people on the spectrum?
So that is something that we most definitely, because anything education based. So yes, that is something that we can set as a goal in terms of, sex ed, or connecting them and joining with them for a sex ed class so that we could assist with the comprehension, staying on task, all those executive functioning skills we talked about. So absolutely.
And they also asked if you could please put the phone number back up, or maybe put the contact information for ADAPT in the chat.
Sure.
And the next question is for Terry. Terry, what is the income restriction for the entire family?
Income restriction?
Yes, I believe, so just to clarify, there's 3 grants under Terry's program. 2 of them, I believe, have income restrictions. The access to home for
Got it.
Medicaid
Okay.
and Restore.
Okay, so OPWDD, there's no income restriction. Access to home, if let's say there's 2 people in the household, then with the application, I would send you a chart that you would have to look at before you put in the application. And the chart will show you If there are one person in the household, your income has to be under a certain amount. And if you're in a household of 2 or 3, there's also a list of the income that you have to be under.
But
And
we
that's
still-
based on the area median income of New York City. And you would be able to find that if you type in Google area median income for New York City.
And that's still 80%? Is that the percentage
It's
for
80% for access to home, and for restore program, it's 100%.
Thank you.
Thank you.
And the next person has 3 questions. All right. We may have covered this. When Medicaid won't issue a formal letter of denial, who do we get a less formal? Yes, we did cover that. As someone who has OPWDD self-direction, I just deal with many of these issues through my kids' FI. When would I ever seek out help from ADAPT as opposed to the FI who services our family? And if so, when? Like one thing they say they're unfamiliar with is medical justification required for DRAPL, and so on.
So yes, definitely with the fiscal intermediary broker, you would kind of where you're allocating funds, and you would need to allocate funds to FSS and then the program provider and put a cap, depending on how you'd like to kind of work that out funding wise. In terms of, what was the second part of that?
Who
medical-
would they go to? Really what they want to know is, when would they ever seek out help from ADAPT, or I guess any other provider agency, as opposed to their FI?
So I guess if it's determined, or have a conversation with your FI, where the funds are allocated, they would need to be allocated to an FSS provider. And then at that point, that's when you would be able to access through a provider. Because if it's included under, OTPS or IDGS, then they're saying, OPWDD is basically saying, use those categories. But if it works out that you would like to put it under FSS and a provider agency, then that's when that would happen. But for further information on that, it would be definitely something we would want to walk the family through for more clarification, than if they need more clarification than that.
That probably answers the second part of that second question, because I'm having trouble keeping all of this in mind, like which part is OPWDD and which part is FSS and which part is with ADAPT. So one of the things that caught my eye was there was talk about travel where medical justification is needed. I've been doing this for years and just use OTPS and IDGS, and IDGS has to be in line with a life plan, but I never submit medical letters for it. Is that something different than OTPS and IDGS? What in the presentation when it talked about
it depends. I'm not as familiar with the self-direction categories, or if it works directly through the budget. That's also something maybe we could find out through somebody that, like a director kind of within self-direction, because we really don't handle the budgets. The only piece that we would be under FSS in the budget. And yes, if it's under FSS and you're using a provider, you would need a medical justification, but I'm not sure about, other categories that the family might be using under their budget.
Thank you. Oh, I see Mary has.
It's something we could definitely figure out or connect with somebody that might be more familiar with self-direction.
Also, if someone has accessoride eligibility and they have a behavior that they will not feel comfortable taking, you can call the accessoride hotline that's on your card, and they will approve car service for you, whether it's Uber, Lyft, they will also include a 20% tip.
Wow.
That's on their
Thank
website.
you so much for that. That's great. That's great information.
Thank you. And this is from C Mark. We may have, I don't know if we addressed this question to your satisfaction, but it says, this is about the cap for family reimbursement. My son has a balance from summer camp. The cap was reached. So will I have to pay the balance?
Unfortunately, yes, except I hate to just say no if there's extenuating circumstances or again, some kind of urgent, justifiable emergency situation. We're always open to reach out to your DDRO office in your borough and kind of have this discussion, right? But the short answer is once you've reached the cap, then that's it for the fiscal year.
Thank you. And someone's asking if we could please provide email to apply to home mod program. I see, oh, Terry, the next thing is Terry providing the email and phone number. Thank you, Terry.
Sure.
And that is it in terms of questions in the chat. Again, you can also raise your hand with the raise hand function, or simply unmute yourself if you want to ask a question about any of the information covered, or if you have any information to add on any of the information covered. Ira, yes.
I just had the question about how sort of the process works generally. I am a parent volunteer that works with the CUSAC to go through applications for FSS, and I'm wondering, do all agencies involve parents that way? Is that like a OPWDD mandate, or is that just CUSAC's call?
In terms of having a committee to review applications, I
Yes.
believe it's part of what OPWDD has stated is required now.
Family
for agencies.
reimbursement, it's in the ADM. It actually spells out who you have to have, the minimum number of non-affiliated parents or an individual, self-advocate. So that's spelled out there. So for those decisions and those committees to be made, you have to meet that criteria for that decision to go to OPWDD for the final approval. Please also keep in mind that there's a 2-tier approval process. So first it's internal with the provider and their committee members, right? And then it goes to OPWDD. What we approve internally might be denied by OPWDD from the DDRO within your borough. And a lot of times, I really can't stress enough, it's a conversation. So I never want anyone to shy away from a request. Just because it's not listed on the ADM does not mean with a strong justification, we might be able to get that pushed through. We've seen it many times. So just keep that in mind too. But a lot of times we approve internally a lot of things that are then denied by OPWDD.
And when does the conversation happen? After OPWDD denies it, or
So great question. So that depends. What we recommend, if you have an item that's not clearly spelled out on the ADM, or maybe it's just a little bit more complicated than is what is just on the ADM, we ask you to reach out to our coordinator and let them know this is the item I'd like to request. This is the justification. But before you go through that whole process of the application support docs and justifications and updating life plans and budgets, we will reach out to your DDRO and we will say, this is what we have. What further information would you need for this to be? We can't ask them to approve it, but to be likely, right? To be an approved item. So I hate to say no to anything except for a few items, which they just shoot down 100%. But we will reach out to them and then they'll say, well, you need this. Why can't they do this? Then we'll get back to the family. We'll ask their questions. And if in a lot of cases, we've been able to build the case enough to the point where, yeah, it might not be, I'm just trying to think of an example to make it more concrete. Like on the ADM, it mentions like supplements and vitamins, and that's kind of like a hairy kind of situation because some things are and some things are not. So we request that information up front from the DDRO, and then we can let you know what, most likely, if you could justify this part of it, then it would be approved. So that's kind of how we handle a lot of inquiries from the public, let's say.
That's
Thank
great.
you.
Thanks.
Thank you, Nicole. I see someone else said that this was a lot of information to take in, and yes, it is. We are recording. The recording will be posted likely later on this week on the Manhattan DD Council YouTube page. So please be sure to visit in a day or two. Our tech support for the Manhattan DD Council YouTube page. He usually just takes about 24 hours to post it, but I always like to give him a little extra time. Also, there will be an email sent out with the link to everyone who signed up for email through the Manhattan DD Council website. So not just the people attending here, because we didn't take, registration for this meeting, but if you're signed up to receive emails from the Manhattan DD Council, you'll receive an email with a link to this meeting and this presentation. If you're not sure if you are signed up, by all means, please send me an email. I'll put my email in the chat now, and I can forward it to you the moment it becomes available.
I also want to mention to everybody, especially families where some of this is the first time you're hearing a lot of this, your questions are questions that we've asked along the way. In terms of this being a lot of information, it absolutely is. It's a lot of changing information. It's a lot of things where we reach out, to OPWDD, the DDRO, which is just the office in your borough, the regional office, and we ask a lot of questions. So we are here. We work in partnership with you, care management, self-advocates, and we will walk you through this process from application to letters of justification, reading through life plans. So just know that this is what we're here to do, that, there's no need to have to absorb all of this information today. And any question you have are definitely questions we've asked. So we can assist you with most of it. And if we can't, we will get that information. So it most definitely is, to the parent that just kind of said that, it is, it can be overwhelming if you're not in the field, and it can be overwhelming if you are in the field. So just keep that in mind, that it's just an ongoing process. But providers like us will walk you through every step.
Yes, and the presentation's kept general for a reason, right? Obviously, your particular case is particular to you. So anything that you have in mind now, again, you can reach out to us either through the Project Connect number that was provided, or Terry and I have also provided our contact information. As a reminder, I am also I also work for Adopt Community Network, so I can definitely put you in touch with Nicole or Terry. And also, as Nicole and Lisa mentioned earlier, your care manager is a great source of information as well. They can help you sort of navigate, these waters, if you will, to get the services that are needed for you and your loved one. So by all means, please don't hesitate to ask any of the resources that are available to you on, how to get started, how to get your questions answered, because that's what we're here for. We are a community. And with that, just want to ask again. Oh, Mary, yes.
Can I just share? I think Jackie's also on the Zoom right now, but Jackie Goldberg and I are the co-chairs of the Manhattan Family Support Service Advisory Council. So if no one is on our mailing list, our MailChimp, I'll put it in the chat. I'm also the Family Support Service statewide rep. So if there's any questions anybody has on family reimbursement or any family support services, please reach out to Jackie or I. On the note of ADAPT, they do everything. They have taken this ADM and really worked with it more than any agency that wanted to even touch it. They were the first pioneers to say, let's go. And they are big cheerleaders to help families with this program. So kudos to you guys, and a great presentation. Thanks.
Thank you so much. And thank you for all your support and additional information. Much appreciated.
Thank you, Mary. And thank you again, Terry and Nicole, for this wonderful presentation, which we will make available to everyone as soon as possible through the recording of today's meeting. I just want to remind everyone again about the Manhattan Family Support Services Directory being updated as we speak. If the representative of any particular program that you want to promote for Manhattan residents is not has not been contacted, please let us know. Or if your agency has a new service that you would like to add to the directory, please do let us know as soon as possible as well. And again, we are currently planning the annual Manhattan Manhattan Family and Professional Resource Fair, which we hope to have either in May or June of this year. As the information comes through, we will update you guys. And lastly, our next and final meeting of this school calendar year, because that's what the committee follows, will be May 8th. We will be sending out more information shortly about the topic for our May 8th committee meeting. It will use the same link for today's meeting. So if for whatever reason you're not receiving information about our meetings, if anything, just keep today's link with you and add it to your calendar for May 8th. Thank you. And Lisa, was there anything else you wanted to add or?
Nope, I think this definitely covered a lot. I think we had started to touch a little bit on the importance of working collaboratively on justification letters at the end of our last meeting couple months ago. So this really segues really nicely into the specifics, and especially some of the home modification information and adaptive equipment. It's an area that is sometimes not used enough and definitely useful information. So I'll be sure to take this information back to the care management team at Care Design, definitely, and make sure everyone has it. But thank you, everyone. And we're expecting our next meeting in May to cover some crisis topics, current crisis resources, things to do, ways to get support immediately and more long-term, and some planning around the unexpected. So hopefully we have some really great material waiting for all of you when you come back in 2 months.
Thank you everyone for joining us, and we hope you have a great day.
Take care. Bye, everyone. Thank you.
Thank you so much. Bye, everybody.